Good afternoon to everyone. I'm Lisa Dakanay. I'm the president of the Institute for Social Entrepreneurship in Asia. And I would like to welcome everyone to the second webinar of our COVID-19 social enterprise response and visioning effort. And the webinar series has two objectives. One is to share, collaborate, and network in terms of our response to COVID-19 as a social enterprise sector in Asia. And the second objective is for us to actually reconfigure the platforms that we were in the process of launching and developing to accelerate the sustainable development goals. We were supposed to co-convene a conference with UNSCAP in Bangkok in March in order for us to launch social entrepreneurship SDG acceleration platforms. And actually, I'm very happy that the webinar that we have today, which is the second, the first one being on the World Fair Trade Organization Asia, this second webinar is featuring the initiative of Dompet Dhuafa in Indonesia, and it's on their health initiative in response to COVID, and also what they're doing in terms of contributing to the health situation of the people in Indonesia as a whole. Before I turn over the floor to Haryo Majopahit, who will be from Dompet Dhuafa, who will be moderating this afternoon session. I just wanted to recognize the members of ISEA who are present. Good afternoon. And most especially, I'd like to welcome Pak Bambang Ismawan, because Pak Bambang Ismawan is our founding chair of the Institute for Social Entrepreneurship in Asia and a leading social entrepreneur in Indonesia and Southeast Asia. I would also like to recognize our partners. There's a number from the UN system who are here, but also to recognize Japan Foundation Asia Center, who actually agreed to support the webinar series, our COVID-19 Social Enterprise Response and Visioning Effort webinar series. So without much more ado, I'd like to turn over the floor to Haryo Majopahit to moderate the webinar on Dompet Dhuafa's health initiatives this afternoon. Haryo?
Yes, Lisa. Yeah, thank you so much, Lisa and Gomer, and also our founding fathers, Pak Bambang Ismawan from Bina Swadaya, and also our friends from many organizations and social enterprise. So we have a Selfie Savitri from Dompet Dhuafa, Dr. Susana Balingit. Also, we have Iris Goke Elao, and then we have Bimo Dwi Putro, and we have somebody from Nepal. His organization is Hygiene Nepal, and also Palaniswari. We have Dodo Makasaet, Jai Laksamana, Yekaisu, Teng Fei Wang, Marta Perez Puzo, Marlon, Siska Asmawati, Carla Santos, and Swapan, and also Ahsin Algorizi. Welcome everyone to our webinar discussion today. So today we will discuss about Dompet Dhuafa and its contribution in COVID-19 pandemic in Indonesia. So for you who are not familiar yet with Dompet Dhuafa, maybe I will explain a little bit about Dompet Dhuafa. So let me share my screen. So do you guys can see the screen right now? Yeah, so
yes, we can.
Yeah, this is a quick history about Dompet Dhuafa. So Dompet Dhuafa is formed by two words. So we have Dompet and Dhuafa. So Dompet is wallet in Indonesian language, and Dhuafa is the poor and marginalized people. So, literally, Dompet Dhuafa means the wallet for the poor or the wallet for the marginalized people. And the unique of Dompet Dhuafa is Dompet Dhuafa start from a small column in a national newspaper in Indonesia. So, like the journalists, because they have, concern in social issues in Indonesia, so they like create a small column in a national newspaper named Dompet Dhuafa, and that column was published on July the 2nd in 1993. 1 year after that, because the readers of the newspaper want to support the column, and we need like a legal standing of the organization. So in September the 14th, 1994, 4 journalists, Parni Hadi, Sinansari Ecip, Haidar Bagir, and Eric Sudewo register the organization to the Ministry of Law in Indonesia. So Mr. Parni Hadi, you can see this is Mr. Parni Hadi picture. And right now we have about 200 local branches across Indonesia and 5 local chapters overseas in the USA, in Hong Kong, Japan, South Korea, and Australia. Maybe you will ask, so Dompet Dhuafa is a philanthropy organization or social business ventures. So we do both because right now we have like 2 wings. The first wing is the philanthropic wings, and the second wings is the philanthropic works. So we have, some philanthropy program in healthcare, social services, education, advocacy, and economic empowerment. And, after we accompany the community and empower them, after they have their own community enterprises, so they will become our business partner. So our social business wings, will, approach like communities after our philanthropic program. So they will become our business partners because they already have their own community enterprise. So the community enterprise itself, it can be, it can be like a cooperative, like multi-purpose cooperative, or maybe they can be like a group of farmers, etc. It depends on the community, how they want to build their own community enterprise. So right now, in the healthcare services, Dompet Dhuafa has more than 33 primary clinics across Indonesia, 8 hospitals, and also we have 1 rural bank in Ciputat, Jakarta, and also we have 1 venture capital firm. We have 9 livestock centers, 5 agribusiness and trading companies, and also schools and 1 universities. Yeah. So this is some of our. So maybe if you go to Indonesia, we can bring you to our farms. This is some of our farms and some of our factory, because after we accompany the farmers, sometimes we will buy their crops or their commodities, and we will process it in our factories. So this is our hospital. So maybe Selfie will explain more about our hospital in Indonesia, and not only hospital, but our response in the COVID-19 response. So yeah, I think I think that's a little quick brief about Dompet Dhuafa. So, and I think because here we have Pak Bambang Ismawan, so Dompet Dhuafa also have very close relationship with Bina Swadaya. Bina Swadaya is very well known about its social enterprise, especially in the rural areas. They empower a lot of farmers, organizations, etc. So, and I think that our founders said that, you know, Dompet Dhuafa and Bina Swadaya is like the coalition of Pancasila. Yeah, Pancasila is, you know,
Pancasila in action.
Yeah, Pancasila in action. So Pancasila in action is, you know, Pancasila is our national ideology, and the main slogan is unity in diversity. And I think that Bina Swadaya as co-founding chairs of, you know, ISEA and Dompet Dhuafa is working together in Indonesia, you know, to contribute to the you know, communities all across Indonesia. And right now we already have Selvi Savitri. Selvi Savitri is our international partnership specialist. So Selvi Savitri will explain more about, you know, what is our healthcare program, especially during the COVID-19 pandemic. To Selvi, time is yours.
Okay, thank you so much, Mas Haryo. So Mas is brother ya in Indonesia, so I will call only Mas Haryo. Okay, first of all, I'm Selvi from Dompet Dhuafa as international partnership specialist. I'm so glad to be here today, actually, to share a little bit of our experience for the program and also COVID-19 response in Indonesia. Can I share my screen also? Okay, wait.
Yes, you may.
Yeah. Okay. Yeah. Okay. Already, all of you already see my screen, yeah?
Yes. Yes,
yeah.
we can see it.
Okay. Before we talk about Dompet Dhuafa response for COVID-19, I think I will share a little bit more about Dompet Dhuafa. Okay. Okay. This is actually Dompet Dhuafa. Dompet Dhuafa is a philanthropy institution and also social enterprise institution. We do both, like Mas Haryo said before, and then this is our beneficiaries in 2019. Yeah, you can see here. And then our program actually focus on social development program, health, economic, education, and also dakwah and culture in Indonesia. Then because this webinar focus only for the health program, so I will make a little bit detail about our health program. Okay, this is actually Dompet Dhuafa health program for Sustainable Development Goals or SDGs program. So we contribute for the first one is for zero hunger, and then for the good health and well-being, for the gender equality, and then the last one is for the clean water and sanitation. This is the first point of our contribution for SDGs. The first one is for zero hunger. Actually, Dompet Dhuafa already did like the prevalence of anemia in pregnant women in Banten, Aceh, Jakarta, West Java, Yogyakarta, and also Nusa Tenggara Timur. And then the second one, we also did like percentage of babies or infants less than 6 months who are exclusively breastfed. Also in Banten, Aceh, Jawa, West Java, and then Yogyakarta, and also Nusa Tenggara Timur. And the third one, our contribution for the zero hunger is for the prevalence of malnutrition or underweight in toddlers. This one, and then the next, our contribution for the good health and well-being. We also contribute for like we utilize national health insurance coverage, or we call it Jaminan Kesehatan Nasional in Indonesia. So we collaborate with this national health insurance in some our hospital network. There is Rumah Sehat Terpadu, and then Rumah Sakit Akasri Bawono, and then RSAW, and also Rumah Sakit Lancang Kuning. And then the next one, we also contribute for the tuberculosis or TB incidence for 100,000 population. So we do like screening for the new cases of TB. We do also treatment and also referral for the hospital in Indonesia. Yeah, this is the separate location of TB program of Dompet Dhuafa all over Indonesia. Okay, the next one is for gender equality. The first, our indicator program for the Indonesian law or government regulation that guarantees women and to get services. So the conclusion is we educate the women. We give the education related to the sexual and reproductive health in Indonesia. Okay, specifically region in West Java and Papua. And then the next, we also contribute for the clean water and sanitation. Actually, the indicator of our program is percentage of households that have access to proper sanitation services. So this is our intervention. Oh yeah, actually, because here also there is Pak Bambang Ismawan. I think for the project in Palu, Donggala, Sigi, I mean Central Sulawesi, after the disaster, we do also with Bina Swadaya, but in different focus. Dompet Dhuafa in sanitation and clean water, and Bina Swadaya in SMES, social medium enterprise. Like that. This is the chart of change in sanitation pattern. Yeah. Okay, that's all. A little bit brief about our health programs in Indonesia. And then the next we will I will explain a little bit about the Dompet Dhuafa response and contribution to Indonesia health sector amid COVID-19. Yeah, this is the situation update right now about the COVID-19. And then in Indonesia, okay, until 31 May, there are 26,000 more the patient of COVID-19. And then this is the affected regions in Indonesia. There are 34 provinces all over Indonesia. In Indonesia, then Dompet Dhuafa have several programs to respond to this COVID-19 cases. Okay, in Dompet Dhuafa, I will like categorize for 3 phase program of Dompet Dhuafa to respond to the COVID. The first, our response phase is we built like call center hotline for COVID-19 24 hours. So everyone, the people in Indonesia can call the call center hotline by Dompet Dhuafa. Then they can like ask Dompet Dhuafa anything about what they feel. Maybe they feel like anxiety or a trauma or anything about COVID, and then we will like give the suggestion or referral during this condition. And then the second one, we also have like education for clean and health behavior for the community. And then we do also spraying disinfectant services for public areas of Indonesia. And also we have the program like logistic and hygiene kit distribution for some institution and for some public areas in Indonesia. And then also we deliver like our ambulance and health facilities like Mas Haryo said, we have more than 30 clinics all over Indonesia. So yeah, we collaborate with them to respond to the COVID. And then also we providing the protective medical gear for the medical personnel in the hospitals and then also in the clinics and public facility. Public health services. And then the next we also do the work from home, of course, for our AMIL. And then the next one, we also open for the medical volunteers for COVID response. And because in Indonesia, it's a little bit hype about the corps services in Indonesia, because everyone like feel anxiety and don't want to care another when the people die. So Dompet Dhuafa also have the program for the corps services. This is our like separate location of our program in Indonesia in first phase. And then this is like a little bit documentation. Oh yeah, sorry, this is still in bahasa. This is documentation for the distribution of hygiene kits from Dompet Dhuafa. And then yeah, this is also the documentation. And then this is the documentation of spraying the public facility in Indonesia. Okay, this is like food package. I mean, for the medical personnel. Now, after the phase 1, we also entered the phase 2 of the Dompet Dhuafa response for the COVID-19. So the first one, we utilize our hospitals network in Indonesia for the initial phase for ODP and PDP. I mean, like a COVID-19 patient in Indonesia. And then also we built like container hospital. So this container hospital built especially for the recover of the COVID patient, something like that. And then the second one, we keep like do volunteer spraying disinfectant, and then still emergency hotline COVID-19, and also we deliver the 30 unit ambulance for the hospitals around Indonesia. And oh yeah, and then also we built like disinfection chamber for the public facility in Indonesia. I will explain a little bit more after this about disinfection chamber. And also we open our clinics. Oh yeah, our 21 clinics all over Indonesia to respond the initial phase for the COVID-19 cases. And then we not only open for the emergency hotline COVID-19, but also open for the psychosocial support for the COVID-19. And then the next one, we also have like 5 ambulance unit corps. This is actually our hospitals network all over Indonesia, and also our clinics all over Indonesia. Maybe you can see here. So a little bit about our hospitals. Actually, our hospitals utilize blended finance here. So we use like wakaf or endowment finance for the land, and then also for the building. But for the operational, we collaborate with government. So we utilize the government insurance, national government insurance. We call it BPJS. Yeah, you know, to give fund for the patient who come to our hospitals for the treatment. And then besides that, we also open for the investment, and we also utilize like zakat and infak funds for the treatment in this hospital. So actually, this hospital that I showed in my screen open for the COVID-19 patient for the initial phase. Nah, and then this is our container emergency hospital already open and operating in Indonesia in Rumah Sakit Kartika Pulau Mas Hospital. Okay, this is like documentation, the public facility that have our services. Like there is mosque and then churches, monastery, education facility, orphanage, LRT station, settlement, restaurant and shop, and etc. Oh yeah, and also Dompet Dhuafa have like a program cash forward for the online drivers. So we collaborate with Gojek and also Grab to like deliver our food package, deliver our our services to the beneficiaries. So because now in Indonesia, we think like online drivers has like decrease of income during this COVID-19. Then this is the separate location of our spraying disinfection services all over Indonesia. Yeah, I think it's already from Aceh to Papua. Now, then this is our disinfection chamber. Actually, because disinfection chamber has been already tested in Vietnam previously, so Vietnam's success in suppressing the number of spread of COVID-19 cases in their country. So our disaster management center initiated to create the design of the similar disinfection chamber, but actually the name is not disinfection chamber, but ABC, antiseptic body chamber. Why antiseptic body chamber? Because this chamber is safe for our skin and for our eyes. So yeah, we can use this chamber without any anxiety and etc. for irritation and yeah, for the irritation I mean. So together we invite all the corporate donors, all the other parties, and then also influencer, social media influencer in Indonesia to create a campaign. So we can install more than 100 disinfection chamber in Indonesia and other provinces in Indonesia I mean. So until now, I think this is distribution map of disinfection chamber in all over province of Indonesia. If we can see Jakarta, I mean the amount of disinfection chamber in Jakarta is so big amount in here. This is because Jakarta is like center of the COVID-19 right now in Indonesia. This is the documentation of our disinfection chamber or antiseptic body chamber. Our governor of Jakarta, Anies Baswedan, also like tried the antiseptic body chambers in East Jakarta. Oh yeah, sorry. Okay, not only disinfection chamber, but also we install like the hand washing facility beside the disinfection chamber usually. And in our hospital network, we also have like rapid test COVID-19. So yeah, this is like open for public, but we have like some assessment for the people who wants to do like rapid test COVID-19 for free. And then after we did all the programs in phase 2, we have another challenge. It's about like people living under poverty increase, and then also about unemployment growth projection also. So Dompet Dhuafa initiate the phase 3 of the response COVID-19. What is the program in phase 3? Okay, the first one is basic food distribution in Jakarta, around, and all over province in Indonesia. And then the second is food garden for household. And then also the third one is Kampung Cekal COVID. In here, I think there is Ibu Stiving Lestari, maybe Ibu Stiving, Ibu Stiving also can help to explain about Kampung Cekal COVID after my presentation. Okay, so this is like basic food distribution from Dompet Dhuafa. So we deliver food package like basic food for the vulnerable families in Indonesia during this pandemic. Then to do like deliver food package, we also collaborate with other parties all over Indonesia because we cannot do it alone. Okay, we cannot do it alone. Even we like use zakat and then also donation fund. So yeah, we collaborate with the first one is for the with the government of Indonesia. Example, we also collaborate with the local government in Jakarta. So because local government in Jakarta initiate like collaboration social assistance in Jakarta, and then Dompet Dhuafa take a part of this program. So everyone or every people, every community who cannot like eat because there is no food to eat in their house, they also can like give a request in this web page. And then for the donors also who want to like donate for the COVID-19, especially for the deliver food package program, so they can use this platform. This is the web page looks like. And then we also collaborate with other parties like even the animation I mean like the animation cartoon from Malaysia will also collaborate with us for the food security program. And then we also collaborate with like a brand, smartphone brand like Oppo. And then yeah, we also collaborate with all musicians. I mean like several musicians in Indonesia. So we do like charity concert from their home. And then everyone can who watch this concert can donate directly through like payment gateway through Gojek, and also through the GrabPay, through the payment channel, and then also like barcode. This is the documentation for the food for Dhuafa for the beneficiaries. Yeah, I mean, so maybe they can fulfill their nutrition during the COVID. This is the separate locations of this program. Okay, and then the next program is the food garden and kettle in the bucket for the household. So this is like I mean like the purpose of this program is to fulfill the nutrition, especially for the vitamin, minerals, and then also protein, but from their home for the household scale. So Dompet Dhuafa, like we start give the community training about how to grow and plant the food in small garden. Yeah, between the traditional or hydroponic way. And then after this, we also supply the gardening tools and then materials for the community. And then after this, they can apply like what they get from the training, and then we do like monitoring evaluation for this community. This is the kettle in the bucket program. Okay, so how we like utilize this program as social enterprise? Maybe this is like apa ya, a tiny example ya, a small example from us. So we do like we educate the community through the social media. So we create like a campaign like this. So we show how you can plant the food in small garden like this. So we educate the community how to plant, and then in the end of the instruction, we do like we promote our product, our empowerment product from our community base to the public. So everyone who wants to try this hydroponic or this food garden, they can buy all the materials and tools through our empowerment community program, something like this. Yeah. Okay, this is actually our collaborators or the other parties like support for this COVID-19 program. Okay. This is like documentation of publication that we have to educate the community about the health program, and then also how to they have to respond during the COVID. Hey, so okay, yeah, I think that's all. Sorry, I think that's all about Dompet Dhuafa response during the COVID-19. Mas Haryo, thank you.
Okay, thank you, Selfie, for explaining you know, some of the Dompet Dhuafa works on the field during the COVID-19, and also our healthcare social enterprises. So after this, we will we will discuss about the situation in the Philippines with our doctor Susan Balingit. So Dr. Susan Balingit is a doctor, still active, still active as a doctor, and also a medical doctor, and also accompany the community through the organization health program. So Dr. Balingit, time is yours. So maybe you can explain how is the situation in the Philippines and how your organization or your ventures work to overcome some of social issues or health care issues in the Philippines.
So first, let me congratulate Dompet Dhuafa for the amazing work they've been doing. But let me, because I only have 5 minutes, let me just share what we do for health work, the community-based health work. Actually, the focus is not on treating COVID, but the focus is more on promoting health and preventing diseases. We do not have the same massive network of resources that Dompet Dhuafa have, but we do have a lot of people who works with us. And these are the community who have been introduced to using what's local and what's endemic in terms of supporting their health. So what we're trying to do in the most community that we cover is to COVID-proof our people. To ensure that they don't catch it, not because they wash their hands, not because they did the mask, but because they're internally strong. So we strengthen their immune capacity, not by supplements, but more with using what has been traditionally used as food. So we're going back to what has been used locally because we have a long history. Like, I agree with having to protect pregnant women, but you know, in the Philippines, we have a history of women who are so able to deliver 7 to 27 children without a doctor. And being able to raise them, pounding rice, fetching water, and gathering firewoods and chopping them. And at night, they sleep on starched linen. So that's how strong our women were before. So what we're trying to do now is track down commodities that has entered communities that only COVID. We're not just tracing COVID, we're also tracing commodities that enters the community that created ill health. And that's where we start. So we try to promote how strong we were. Because like we were taught in school, every time we see children walk 5 to 7 kilometers to get to school, we would always call them pitiful. Some children in our communities would even swim to get to school. So we are into the process of changing this narrative. Instead of calling them pitiful, we're trying to call them strong, focused, determined, healthy. And if the government would want strong, focused, determined, healthy children, they will not have to look to where these children are going. But instead, we would want them to look back to where these children came from and realize how much resources the community has to make very strong, very focused, very healthy children and very strong women. So with that, we also do some protecting of the environment so that we do policies support, we lobby for policy so that we do not allow destruction of the communities, so that even water can be safe. If deforestation is not halted, then we will have a lot of our people not having enough water, or even having contaminated water, or even having to drink recycled water. But we still have, in many of the communities we have, a lot of fresh water resources. The country claims to be one of the most eco-diverse. So with that, we would like to use all these massive resources in favor of our people. So I think what Dompet Dhuafa have in terms of finance resources, but I think the country has enough natural resources that has traditionally sustained our people, and for as long as we hold on to that, then we can make very strong people who can really resist COVID at no cost. So in the many communities that we've been working, COVID has really been was not able to enter. Actually, our people, our communities were the one doing the manning. They tried to quarantine themselves, ensuring that nobody enters whether tested or not, but they make sure that they know each other and that they would know who enters at whatever time. So this is the community work that we're trying to do in the Philippines, to make sure in the many communities, whether that's urban or rural, that's how we do it. The community participates even in tracking and tracing people because they know each other. That's about it. Thank you.
Okay, thank you so much, Dr. Susan. Yeah, I think that's the most important thing is how we can like promoting and prevent, you know, like the healthy behavior in our community.
Promote health and prevent diseases.
Yeah, yes.
That includes COVID.
Yeah, that includes COVID. So with local wisdom, right? So maybe you have local food, local recipes, you know, local crops maybe who can increase the immunity of the community. So thank you so much for sharing that, Dr. Susan. So, and we have one more doctor, Dr. Sifing. So Dr. Sifing is from the Department of Prevention and Promoting Health and Prevent Disease Department in Dompet Dhuafa. So, Mbak Sifing, so maybe you can share a little bit about your program.
Thank you, Mr. Haryo. Good afternoon, everyone. And for the previous speakers, thanks for the sharing. The sharing is, well, Dompet Dhuafa also, it was very impressive hear from Dr. Balinggit about what Filipino people are doing to prevent the how to be strong to prevent the spread of coronavirus or COVID-19, and how to increase the state of community health conditions to be able to stand during these pandemic situations. So what I'm going to share, it is a little bit of our program is what we mentioned before by Mrs. Selfie, is about Kampung Cekal Corona. This is a community based prevention and promotion model of how to manage people in a very small area, like where we have a community about 200 people, 200 families living in the same area. So basically, we create or we develop a community empowerment or community effort, how to be more ready or to prevent or to be more healthy during the pandemic situations. So we have one sample in Serang and one city in Serang. So we we make a collaboration, of course, with the community setting, with the local government also. To the first is make one group consists of people, consists of important people in the locations to have some jobs to make a surveillance first. We call our facilitator program. So to make a surveillance, simple surveillance, through Google Form to identify which people in that community are in risk of COVID-19 infections. This is the first one. So there is a surveillance. The secondly is we also start to collect the data. At the same time, we also collect the data of general health conditions of all the populations through our cadres, health cadre or health facilitator in the area. It comes, they come from the people, people in the community. And this, the third, we will follow this surveillance with some intervention according to the first who are in risk of to get COVID-19 infection. Secondly, who are in the prone of health problem. And the third is who are get the impact of economic conditions. So based on that, so then we and also we identify also the level of knowledge of the community, how to prevent or how to make their body become their self become more healthier, and also are able to face this pandemic. So there are education also. We spread some poster and some flyer to the community, and through door to door, our cadre also come to their house to follow those who are having health problem. And also because at the same time our community health facility are closed because of what they are not able to make crowd situation. So usually people will come to this community like once a month to get free service of service of health from the healthcare in the public. But since the COVID-19 pandemic, they are not able to get this service. So our team will come based on the surveillance. We will see these people in their home. The next is we also encouraging the people, also assist them to get face mask and some supplies to maintain their health hygiene, their hygienes like hand washings, hand sanitizer, and also hand washing, hand soap for their hand washing, and also assist them to have some public facility in their public facility to have hand washing, hand wash stations before entering their community. And also there are also checking in the postcode for all people who are come in, especially who come into their area, to make sure that they are in a health condition by giving the standard medical checking, like measuring the body temperature, and also giving some simple question about their health conditions. So in the end, we also give some support to those who are in prone conditions, like elderly, family with elderly, and then the elderly, and then family with babies, and also those are in non-communicable disease like hypertension, diabetes, and also health problem of the cardiac health problem. So we assist them with, we try to encourage them to use what they have at home to increase their immunity, and also if it is necessary, so we will assist them with some package of nutritions, not only basic food, but also additional supplement like vitamin C and also some fruits and also nuts, something like that. At the end of this, after 1 month of this program, we from 400 people we elaborate in the area. So there are 3 people are have risk to get contaminated with COVID. But after that, then we refer to the community, government community public health. And then after that, they got the quarantine. And then after another 14 days, they can come back to the community to go another to go life normal, something like that. So what is the most important is, I think, how to help the people, because our this community is actually they live in the city, but they come from a low level of economic and also educations. So how to help them to get more ready, more readiness, and also awareness of how to have a healthy behavior during this pandemic. This is a little sharing, Mr. Haryo, about what we have done in Serang. Thank you.
Okay, thank you so much, Dr. Siti. So, and I want to apologize before you text me about the time. But I think that we are going to be running behind the schedule. I think our webinar will take more than 1 hour. I hope everybody's okay with that. So after this, we will have like an open forum. So maybe you can ask or share your ideas about how social enterprise, can contribute during this pandemic or this crisis maybe. So please feel free to ask, to share your idea. So, but before you start, unmute yourself. Please, ask questions on the chat box. So maybe after that we can unmute yourself. Thank you so much. So, is there any questions, ideas, suggestions? Please feel free. Okay, so we have questions for Marta Perez-Cuso. So Marta, maybe you can unmute yourself and then ask the question directly, maybe to Selfie or to Dr. Susana or to Dr. Siti. So please, you can unmute yourself.
Thank you very much. Thank you for this very interesting webinar and the opportunity to hear directly from those of you working on the response to COVID-19. My name is Marta Perez. I work at ESCAP. One of my areas of work is promoting policies that support social enterprises and inclusive businesses. And I'm very much interested in understanding how social enterprises and inclusive businesses have been affected by the COVID-19 and how they're responding. And in particularly, I would like to explore inclusive businesses and social enterprises working in the health sector, and which business models, how they have been affected, their business models, how they have been affected by COVID-19, and then which new business models they're developing from a commercial point of view or are planning to develop to respond to COVID-19. I see that many of you have been talking of very valuable efforts from a civil society organization, from a non-profit organization point of view, which it's extremely valuable. There is then also the other way how, from a commercial point of view, these social enterprises and inclusive business can work alongside non-governmental organizations and government actors in responding and building back better from COVID-19. And I'm particularly interested in those business models. So we'd love to hear back from you.
Okay, thank you, Martha. So maybe Selfie, maybe you can directly answer.
Oh yeah, okay, sorry. I'm looking for the button of mute. Yeah, okay, thank you, Martha, isn't it? Yeah, okay, thank you very much for the good question, actually, about the, okay. This is about how we do our project, our programs during the COVID-19, about the, isn't it? Yeah, Mas Aryo.
Yes, how, like the previous explanation is mostly on the non-profit perspective.
Yeah.
So how in the social enterprise or the commercial basis, perspective?
Yeah, okay. For this program, in our social enterprise side, actually because Dompet Dhuafa is already like built some like health facilities in some province of Indonesia, some cities of Indonesia, and this, all the operation, all the funds for these programs are come from, like I said before, blended finance between the philanthropy side and then also social enterprise side. That's why we call it also social enterprise. So this blended, the funds are comes from, the first one is investment, of course. Example for our hospitals. So mostly we didn't like build our hospital from the first. So this is like the hospital like already expand, but the management maybe there is an issue with this management of this hospital. So they cannot like build up the hospital. They cannot like operate more the hospital. So Dompet Dhuafa enter for this hospital, and then we also like add on like some investment to the hospitals, and then we manage the management with our research. So this is like a blended finance between like investment, and then we blend with the wakaf and what is wakaf, Mas Aryo?
So wakaf is a trust fund.
Oh yeah, trust fund, social trust fund. So we blend it together, and then we make it like social business, something like this.
Yeah.
Maybe
okay.
Mas Aryo, do you want to add on?
Yeah, I think that Dr. Sifing, who already on the healthcare sector sector, so maybe Dr. Sifing can add more about the healthcare business, and is there any new services during the
COVID?
pandemic? Yes.
This is Martha, thank you for your question, and I think this is a very interesting question because I think it happened to every industry, including health sector. What we call, yes, also we have pandemic condition also in this business. Our hospital visit is and also our bed occupancy rates are decreasing, and it almost reached to 40% of BOR. So previously, our hospital bed occupancy rates about more than 80 to 85% in average during 1 month. But after this pandemic, and along with fearness of people. People are afraid, are fear to come to the hospital because of the getting infection from the hospital. So there are avoiding to come to the hospital. This of course resulting in the decreasing of the final condition in the hospital. The same thing happened in our clinic also. So our clinic visit is also decreased until about less than 50%. But I think it happened not only for us, but for in all over of Indonesia in general. But in some hospitals, so they turn like what discussed before. So we try to open the new services by opening a special ward for those who are getting risk, or we call it people in observation to get COVID-19 infections before it was confirmed, before they will be confirmed that they are really infected, and will be referred to another hospital, because this is our government will give some incentive, or not incentive actually, they will pay also for our universal, our health coverage also will cover this type of patient without checking or without wondering whether they have insurance or not. This is the first one. The second one, we also offer some service to be proactive to sending service at home. From example, home care, because actually in our hospital is not this is not a regular basis. We are giving home care for our customer, but in this pandemic, we are also opening a service to give health services to our patient home, something like that. But in other side, in the philanthropic side, we also offer a mobile healthcare service. Like we will identify who are those people are in need to be visited because of their chronic illness. But in this sector, of course, we are giving for free, and the philanthropic or public funding will cover this cost, because Dompet Dhuafa is also humanitarian organizations. I think this is what we can explain, what we can share with you, Martha. Thank you.
Yeah, and also we have Palaniswari from Dan Foundation, India. She wants to add some answers to our discussion today. So Palaniswari, can you unmute yourself and then turn on your camera, please? Yeah, go ahead.
Good afternoon, everyone. So thanks for allowing me to talk. So it's a very good forum. So thanks for the opportunity given by. So I couldn't able to spell your names. Anyway, thank you to everyone. So it's the first meeting. Can you see me now? Yeah.
Yes,
so,
we can see you.
We are running some. Yeah, thank you, Harry. So we are doing a lot of health initiatives in India, especially in Tamil Nadu and other northern states. Actually, this Dan Foundation is working for the community people. So we are working mainly for the poverty reduction programs. The Dan Foundation is not only doing the health programs, it is main initiative is organizing the poor people, and we are working on the holistic way of working for the community. So we are starting with financial programs. First we will organize the community, then we are doing the financial intermediation programs for the people by linking them with the banks and arranging their livelihoods. And then we are focusing on the health. So at present, I am having 20 years of experience in Dhan Foundation. Basically, I am an agriculture graduate, but I am now looking after the health initiative of Dhan Foundation. And I am looking after some 8 hospitals, community-owned hospitals. And so we are with a team of some 30 doctors. And we are running these community hospitals with some minimum 50 beds in some 8 areas, in the community areas. We are not that much big like Dhuafa in reaching, in having hospitals, but we are very big in reaching the communities. We are having 13 lakhs people with a membership, and we are doing different works for the community. So now I am coming back to the point what that Mario asked. So how we are going to do our health care business in this situation? Here in India, the first problem is increasing the cost of service, especially in the point of community. If they are going for the normal treatment, even for a surgery, when the surgery cost before COVID is different, now the surgery cost of COVID is different, especially on the hygiene part. So everyone is asking for now PPE kit. Even running the hospital in a OPD setup also, we need to provide this all mask. Daily we have to provide mask, gloves. The cost per treatment of a patient is increased after this COVID. But this is what this is the change we are expecting in future. Do not have these kind of infections in future. But we should sustain this behavioral change for facing the future pandemic. So this is what the sustainable behavioral change communication we wish to communicate to the entire community. So this for compacting COVID, Dhan is doing a lot of things. So it divided these three phases of activities. So first it is doing relief. Then in this COVID resilience, it is focusing on the relief phase and the resilience, rehabilitation phase and the resilience phase. So we are planning to reach the last mile worker to work with next 3 years on this COVID compacting. So in the first initial phase onwards, we are providing the food to the entire community wherever we are working, because we are having different federations set up in each and every community area. So through that federation, so we are providing food. That is the first relief activities we are providing. And the next one is, and we are providing this Somaha kit, which means we are giving the behavioral change communication for the social distancing and using a hand wash and mask providing. These are the 3 we are providing to the community, to the entire population and to their family members. So for that, we are providing the kits to the entire community. Like first thing is we are educating, then we are providing masks to our entire community members, and we are providing this sanitizers, and we are teaching them to make soaps by their own, which will reduce the cost. And this is a very important change. We should give a communication to the entire our community. And in the perspective of this hospital side, even we are running this 8 hospitals. Last 2 months, there is no inpatients in our hospital. So even our bed occupancy is 0. So even then we paid 100% salary to our doctors and nurses because we earned something minimum. But our hospital cost is 40% less than the market rate. Even then we have, by God's grace, we have some money in our hand and we provided last 2 months salary. But how we are going to do our future business? That is what the question in front of all of us. So what we are doing now, so we are starting to reach our members through teleconsultation. So here I am in India, and even I will say Tamil Nadu, in Theni. So one small district I am here. Even connecting with you people through this Zoom. So why can't I can connect my community through this technological things. This digitalization is the only solution, and it will reach to our community, and we can provide all our communication through virtual wellness centers. This is what the concept we are newly emerging, and our executive director, Mr. MP Wasimale, he given this opportunity for me to interact with you people, and with his guidance, we initiated a lot of virtual wellness centers. Here, we no need to touch our patients, but they will get the whatever the service we wish to have, and this will help to reach our last mile community. This is what the thing our executive directors repeatedly telling, the reaching last mile member. So with that objective, we are initiating a lot of our virtual wellness center in each and every village and tribal area, and we are start doing our businesses, and which will not affect much because this healthcare sector, which is need of the hour, even we are receiving a lot of negative things also. Without the hospitals, how the people were existed in the last 2 months, why can't they will run without the hospital? But here that is not possible. They will depend on the hospital sector. There is a need always be there. So we will be there always, but we should change our strategies and we should react based on the need from the community. That's what I want to say.
Okay.
Thank you so much.
Thank you so much for understanding.
I'm not taking much time. Thank you.
No problem. Okay, so and also we have Dr. Susana Balingit. So Dr. Susana, maybe you want to, share some thoughts, ideas.
Yes, I've been doing community-based health work for the past 30 years. And the indicator of good health, community-based health work is when people are well and nobody gets sick. When we can make doctors and hospitals obsolete. So even the non-communicable diseases that people don't used to have in the communities should not be present. So prior to COVID coming in, we also ensure that our people are healthy. And so that even the agriculture side that supports the wellness of the people should be something that is community managed, so that when something like lockdown happens, people still have food to eat, because the relief operation happens several days after the lockdown. If they don't have anything to eat, if they didn't plant anything, or if the food they planted is not the food they eat, then we have a problem. But then people had been using local resources, so they've been trained to use local resources to ensure healthy body, strong body that is COVID proof and even communicable disease proof. Then I think whatever happens, no matter what pandemic comes, the community where we are in should be free from all those problems. That's it. Thank you.
Okay, thank you so much, Dr. Susana Balingit. So this is very interesting discussion, and I think that we are agreed that health is an asset for some people. Without health, we cannot go to work. We cannot do something productive. So I think that if we stay to make our community healthy, healthier and healthier, I think that our community will be very productive. So it's already 5:15. We are already running behind the schedule, and I think that we can discuss more maybe through email. So maybe you can email Selfie or email Dr. Sifing, email Dr. Susana to discuss more about our topic today. So and I think that if you want to visit some of Dompet Dhuafa program, so please visit us online during this pandemic. So or maybe you can come to Dompet Dhuafa after the pandemic over. So and I think that we would be more than happy, to welcome you here in Indonesia. And yeah, so I think this is the end of our session today. So I will give back the microphone to Lisa as our president of ISEA. So Lisa. And I think that Gomer will send the PPTs if you want some materials from this discussion. Thank you so much for the opportunity to share our experience in Indonesia.
Thank you very much, Hario, and thank you very much to Dompet Dhuafa, also to Dan Foundation and actually Peter M for sharing your health initiatives. I think the purpose of this webinar is to actually not only tackle the response to COVID-19, but also to start discussing how we can put together the Health for All social entrepreneurship SDG acceleration platform that Dompet Dhuafa was supposed to lead, no? When we were going to have our conference in March. So actually Martha was going to facilitate that process of dialogue between the UN system and us in that conference that we were having we were supposed to have in March. No? So I'm glad that Martha is here and actually joined the discussion in terms of the Health for All platform that is evolving, I think. So I guess before the pandemic, we were all set to actually explore setting up a Health for All social entrepreneurship SDG platform that was focused on preventive health, while at the same time providing perspectives for treatment that are pro-poor, yeah? And I think if there's anything that the Dompet Dhuafa health program is all about, no? It is biased in favor of ensuring that the poor have health services, yeah? And maybe in this process of discussion, we, as Martha has been pointing out, social enterprises that are into health, like the social enterprises that are the hospitals of Dompet Dhuafa and also the clinics of Dan Foundation, no? They have been experiencing problems and issues. And you have also been going into new services like virtual wellness centers and home care services. So maybe in response to the pandemic, there are actually new opportunities for social enterprises to flourish, no? But as social enterprises that are social mission driven, and because we are discussing actually a service that is a public good, no? That actually should not just be available to those who can afford it, but to everyone. I think it's very important that the Dompet Dhuafa perspective of blended financing, or even the financing that combines zakat, wakaf, infaq with government financing, private investments, in order for us to ensure that health services and preventive health services also, or preventive health care and community-based health are actually pursued in our countries, is actually happens as part of the Health for All platform that we are building. So with that, I'm really happy that we have the makings of a core group, I think, Hario. We have the makings of a core group for the Health for All platform that we're wanting to set up with Dompet Dhuafa, Dan Foundation, and PRM. And I think we can continue our dialogue with UN through Martha also, in terms of how social enterprises and inclusive businesses can work with us to promote Health for All. And I'm really happy that we had this webinar. And this is not the end. We may have a second batch of webinars in relation to the topics that we started, but we may also talk about health again in the other webinars that are forthcoming. With that, I'd like to say thank you to everyone, to our members and partners who came to this webinar. And may we also invite you to the next webinar on June 9, 2020. We will be featuring CISIP, the Center for Social Innovation Promotion of Vietnam, who will be sharing their perspectives and their experience in responding to COVID-19 on June 9 at 4 p.m. Manila time, 3 p.m. Indonesia time, 1:30 p.m. India time. Yeah. So thank you very much to everyone.
Thank you, Mary. Thank you so much.
Thank you very much. That was a great webinar. Thank you so much. Bye-bye.
Yeah, thank you so much,
Thank
everyone.
you. Thank you.
Thank you.
Thank you, Lisa. Thank you, Gomer, Pak
Thank
Bambang,
you.
Dr. Susana, Selfie.
Yeah,
Thank you very much.
Susan.
And see you
everyone.
again.
Oh, yeah.
See you.
Yeah.
See you.
Bye.
Bye.
Bye.